Once again, a very warm thank you and welcome. Hello, Gauri. Hello. Gauri can't hear you.
They're not unmuting me.
IT, please unmute. Ms. Gauri Suri, please.
Hello.
Anyway, I think there is some technical issue. So I would now request, Gauri, can you hear me? Hello?
Sir, you are already unmuted. Please speak. I did that one.
Thank you. Now, introduce to you all our day chair, Ms. Archana Mangi. Archana, after having spent 15 years as a homemaker, followed her passion for jewelry and silver and started a boutique in Uma 5 years ago. She personally selects each piece with love for metal and keeps in mind different clientele that walks into the store. Archana, over to you.
Thank you, Kiranji and the executive committee. Welcome Dr. Sushil Bansal on our panel host guest. Today we are here to address an important issue in health, heart, liver, etc. But has anyone ever thought that it affects our brain too? Let's talk about this in depth with Dr. Bansal. Dr. Bansal, you've had such an illustrious career, and any place could have been your beckoning. Why did you choose Dehradun as a place to work?
Thank you, Arjuna. A lot of distance. Can you hear me all right? Hello?
I think one of you will have to go mute.
Can I just 1 second, please? Not this one. No. That's not. Hello, sorry about that. Archana, thank you very much. Good afternoon, ladies and gentlemen. And I see there are some friends joining us from USA as well. Good morning to you in USA, and I think 1 or 2 I can see from England as well. Good morning to UK as well. Thank you. Thank you very much for inviting me to come and ask to have this presentation this afternoon. Well, you say to me, why Dehradun? And I say, why not Dehradun? I had an association with Dehradun since 1966. And I've been coming and going to Dehradun. My wife is from Dehradun actually, so this is kind of my sasural. The people of Dehradun, they're very nice. They always open me with heart from heart. And even now, people say that if you overstay in your sasural, you lose your respect. But you guys still look after me. You still have a lot of respect for me, and I'm grateful for that. Thank you very much. So I never thought of any other place, Rachna, apart from Dehradun. So that's all I can say. Thank you. You know that.
People worry about heart attack. Lately, I've heard of a new word on the block, brain attack. What does it mean and what are its implications? Let's start the conversation.
Thank you very much. Archana, can I have my slides, please? Do I do it myself or I thought
Vivek, can you please help us with the slides, please?
Sure, ma'am. Just 1 minute.
Thank you. Thank you very much. Well, can I next slide, please, Vivek? Thank you. Brain attack is nothing more than stroke. Like heart attack, we have a brain attack. When we have a heart attack, the blood supply to the heart stops. Similarly, in the brain attack on the stroke is the blood supply to the brain which gets stopped. This can happen due to a blocked artery or due to rupture of the artery. As a result of that, the brain doesn't get any oxygen or nutrients. And as a result of that, the brain function of the brain get hampered. We know various functions of the brain. It could be ability to move, think, behave, and you can go on talking about the functions of the brain. Or what, because of the lack of blood supply, please, just 1 second. This is causing a lot of distress. I don't know the other computer. But as a result of that, how much damage done, it depends on the location of the blood vessel and the area of the brain where it's affected and the type of the stroke, whether it was a blood clot or whether this is a bleed inside the brain. And the next slide, please. Can you go next one, please? Just take it next way. Just to take a side step, I want to say that the brain attack or the stroke is a part of what we call is non-communicable diseases or the lifestyle diseases. And there are so many lifestyle diseases, some heart disease, stroke, diabetes, cancer, chronic lung disease, and others. And the good thing about it, that the root cause of most of the problems is one, these factors like physical inactivity, alcohol, intake, tobacco, unhealthy diet. You address these and you are addressing the whole lot of it. I just want to take 1 or 2 more slides to talk about the non-communicable disease or lifestyle disease that will kind of set the scene for this. Can I next slide, please? If you look at this in 1990, that's 30 years ago, 60% of the diseases in India were caused by the communicable diseases and 30% were caused by the non-communicable diseases. Scenario has changed now. In last 30 years, 60% of diseases are caused by the non-communicable diseases, which I mentioned, diabetes, heart attack, stroke, cancer, metabolic syndrome, chest diseases. And 30% of diseases are caused by the communicable diseases, infections, like we are talking about infection nowadays, neonatal diseases and the nutritional diseases. Top 10% what we are talking about, these are the injuries, road traffic accidents and the accidents. That's staying more or less same. Last 30 years is gone from maybe 10% to 12% or something like that. Next slide, please. Don't get confused with this, bogged down with this slide. It looks very busy and complicated slide, but let me take you through this slide. Just look at the blue dots. Don't look at the red dots. Blue dots represent the non-communicable disease. In 2005, there is a comparison between 2005 and 2016. There is a 10 years gap. During that time, heart disease has stayed number 1. Chest disease, which was number 3 in 2005, has gone to number 3, number 2nd in 2016, and this is the one we are talking about today. Cerebrovascular disease, it used to be number 6 in 2005 and it's gone to number 4. And sadly, this is still going up in the same direction. We talk of diabetes, which was 13 so many years ago, now is gone to 7th position, and the kidney disease going up the same way as well. And our next slide, please. Well, today we are going to talk about stroke and brain death. I just come back to the main topic again. Can I, next slide, please? And I think this is a very, very important slide, what you have in front of your screen. Just have a look at it, please, carefully, and I'll take you through very, very slowly through this slide. When you are sitting in your dining room or seeing somebody or outside somewhere, if you think this person is behaving oddly, think of FAST, F-A-S-T. And then you need to act fast as well. And I'll take you through what this acronym means. F stands for the face. If you find a facial drooping of a person, suspect a stroke. If you find somebody whose arm is getting weak, he's saying or she's saying, my arm is weak, think of a stroke. If there is a speech problem, think of a stroke. And the time is of essence at that time. Don't delay, and I'll come to that in a minute. After 2 slides, I'll come back to this point again, why I'm saying what I'm saying. Can I, next slide, please? Although I said these 3 things, can I, next slide, please? Although I said about the face, about the arm, and about the speech, there can be a problem with memory, with eyesight, with incontinence, confusion, swallowing as well. Anything of sudden onset, consider stroke as a possibility. Can I, next slide, please? And if you suspect that, they need to be managed. And this will, I guess, this will be the objective when you are managing these patients. Saving the life, salvaging the brain, which is not damaged, which is called penumbra, prevent the complication which could occur following the stroke, rehabilitate them, and what's very important, prevention and the reduction of the stroke recurrence in these cases. I'll walk you through each by one. First, I'll just take these 2 together. Saving the life, I will not touch because that's a specialized area and I'll leave it alone. I'll just take these 2 things together. Salvaging the reversible damaged brain and preventing the complication. Can I, next slide, please? Okay, when we have a stroke, I said it could be either due to the blocked artery, which occurs in the in majority of cases, 85% of cases, stroke will be due to clot. 15% cases will be due to bleed. Can I, next slide, please? So if we have a clot which is blocking the artery, this is inside the brain, what would happen because of the blocked artery? You have a white area, which is the dead tissue, infarcted area, this is the brain is dead. Then you have outside gray area, which is the brown area, which is the healthy area. And then you have this intermediate area, which is called penumbra. And this penumbra area can't make up its mind whether it should go to this side or whether it should go to this side. This is the crucial area. And whatever we are, as a doctor, we are doing in the early stage, we are trying to revive this area. We are trying to push this area from this side to this area. And if it is a clot, which is common in 85% of the cases, then the treatment is to dissolve the clot. We give the drugs, we inject a drug to dissolve the clot, like we do in the heart attack. Same sort of thing we do in these blood vessels as well. But there are a couple of catch points here. We don't know beforehand whether there is a bleeding there or it's only the clot. We don't know that. And for that reason, having a CT scan is absolutely essential before one would consider to give a drug to dissolve it. So CT will pick up if there is a brain. So if there is evidence of brain, giving the clot busting drug is big no, because if you gave it, you know what could happen, bleed inside the brain. Number 1. Number 2, there is a time window, and this is what I was saying in the past. Time is of essence. Window is 3 hours to get the best result out of this stroke. So and this is from the time you need notice the first symptom, time till you get the injection. During that time, patient has to be shifted to a hospital. Patient have to have CT scan. All the indication needs to be assessed, because if there is contraindication and you give that injection, patient will bleed to death. So for that reason, assessment is absolutely vital before this drug is given to these people. And that's what I meant, time is essence. And for this reason, if you suspect your near or dear or neighbor, whosoever that patient have a stroke, please don't take it to your neighbors or to neighboring doctor, to your friendly doctor. Please don't do that, because all they will do, they will confirm this patient has a stroke, which you are already suspecting. You need to go to a center where there is a facility of CT scan and where their facility to dissolve this clot. Next slide, please. If it is a hemorrhage inside the brain, that's a different kettle of fish altogether. This happens in 15% of cases due to stroke, and this could require a surgery. But if this happens, I'm afraid the outcome is very, very poor. It's not very good at all. Can I have next slide, please? So, apart from treating these things, we need to treat the other complications as well, which could be associated with this stroke. They could have a heart attack, they could have a pneumonia, that need to be treated. You need to maintain the hydration, nutrition, bladder and bowel needs to be taken care of. Skin needs to be maintained, and if there any complication would develop, then that need to be treated as well. Can I have next slide, please? So what happens to these people when all this is done? What is the outcome of these people who had this stroke and all this initial treatment has been done in any multi-specialty center? Well, outcome depends very much how severe was the stroke. Where was it? What was the site of lesion? How quickly it got treated? And was there any complication for that? Can I next slide, please? But as a rule of thumb, this is the outcome of this. 25% of people who have a stroke, they will die within 10 days or so. 10 people of this stroke, they will recover completely without you doing anything. Whether you treat them or not, they will get better and they will get up and walk, and doctors will take our credits for we done wonders. But this is the spontaneous recovery which happens, where they have the minor embolism or clot which moved on. 25% people will have a minor impairment following the stroke, and 40% will have a severe impairment following the stroke. So this is the 65% of the population which we need to really talk about for the future care. And I want to remind you at this point as well, this is the first stroke. 30% of these people who had this stroke, they will have a second stroke, possibly within a year as well. So this is, chances of recurrence are very high. This needs to be taken on board as well when we are talking about managing this stroke. Can I next slide, please? These are the data from India. Sadly, there are not many data to share from the India, but this is one of them. So it depends where you are. If you are in Bangalore, your chances of dying within first 28 days are a bit less. It's much better, less than 20%. If you're in Calcutta, you're talking about somewhere about 40%. So it depends where you are. Regional variation, the fatality within first 1 month is quite different at different centers. And our next slide, please. And I think this is not only 28 days what we are talking about. 40% of the people who had a stroke, they will die within 1 year. 60% of the people who had a stroke, they will die within 5 years, next 5 years as well. So it's a pretty lethal condition. You know, you got first episode, 30% death, 40% in 1 year, 60% in 5 years. Can I have next slide, please? And it's not only the death which is a problem. Problem is this disability amongst the stroke survivors. I told you 65% people survive from the stroke. The question is the survival, what happened to them? We see them, they have severe disability, speech problem, physical disability, fatigue, memory, depression and low mood, ranging somewhere from 60 to 90%. It's very, very disappointing and depressing facts, but that's what it is really. Can I next slide, please? So, ladies and gentlemen, if you want to address that particularly last slide, this is the only answer we have. Rehabilitation. That's the only thing we can do. You've done the wonders in the first 5 days in the hospital. You survive, you revive them, you've given them the drug to reduce their initial impact of the disease, but they are left with the disabilities which needs to be looked at now. Can we have next slide, please? And the early rehabilitation is very important because that will influence the health outcome and the recovery from the stroke. So why is that? We know that first 3 months after the stroke, brain is like a new brain. It's ready to learn. It's like a baby. You teach them function and they learn, they start walking, you get them, they start walking. Same sort of thing. The brain is ready to make a new connection, not the nerve cells, connections I'm talking about. And this is called neuroplasticity. The healthy brain cells, they want to reach out to the damaged brain cells and try to make the connections and bring the functions back to them. And this happens within 6 months. So that's the maximum recovery after the stroke, happens within first 3 months. After that, recovery is, I'm afraid, at very slower pace. Can I next slide, please? So early rehabilitation is very important. And this is the American Stroke Society guideline. What it says is that once the patient is medically stable, not needing close medical supervision, and can participate 3 hours of therapy 5 days a week, then they should be discharged from this acute facility to a rehabilitation facility for the rehabilitation. And next slide, please. What I want to emphasize is this: rehabilitation is not physiotherapy alone, because that's what we usually do here. फिजियोथेरेपी हो रही है जी घर में, घर फिजियोथेरेपिस्ट के पास जा रहे हैं जी. Physiotherapy is only one part of rehabilitation. It's important for regaining the strength, balance, and coordination, but during the recovery phase, much more is required. Person need to learn how to eat, how to write, self-hygiene, dressing, undressing, getting in and out of bed, getting to the toilet and all that. Job done by the occupational therapy. Next slide, please. They may have a speech problem for which they will need a speech therapy. They may have a swallowing problem which can be helped by the speech therapy as well in improving that. Can I next slide, please? And then don't forget, lot of survivors will have difficult emotions. They have anxiety and depression. They are very sad. Why me? Why has this happened to me? Not only to the person, to the family as well. And for that reason, help of psychologists, mental health counseling is very, very important part of this management as well. And our next slide, please. For this reason, we need to have a good neurorehabilitation program. And I believe this should be given at one center rather than you or family running around looking for the facility here and there. Physiotherapist, speech therapist, psychologist, and all that sort of thing. You're running pillar to post. So we need to have a rehabilitation program which should be holistic, which cater all the needs of the patient and their family. It should be patient focused. Patient should be in center. Patient should be empowered, and their independence should be maximized by the program. And don't forget, there is a family there as well, which are equally under stress, who need help and support as well. This program should be inclusive and participatory. Family should be participating as well. They need to be included in the management plan of all these people as well. And our next slide, please. Rehab team, they should keep in mind as well that after all this, the whole dynamics of family change. Healthy person walking about and suddenly bedbound, whether it's the breadwinner or the spouse or grandparents or whatever. But the whole dynamics of family changes as a result of that. Caregivers may be there, may not be. They are there, they may not be willing, they might be issues with their time, they might be issue of money. And even if these all issues are not there, all these things are there, the caregiver needs knowledge. How to manage, how to look after a person is supporting the stroke at home. How do we do that? How does the person do that? They're frightened, they're anxious, they're worried, depressed. How do they do that? For that reason, the parting the information and knowledge to these people is equally important, if not more. And our next slide, please. So, ladies and gentlemen, I hope I have proved the point that stroke is a devastating disease. Big killer, number 3 killer in the world. In India, probably will be more. Sadly, we don't have many data, but given the risk factor, we have diabetes, hypertension, which is more in India. I guess it will be even more than 3/3 on the cause. So the prevention and the reduction of the risk factor is the only hope we have. That's the best treatment strategy we have as far as the managing the stroke is concerned. Can I next slide, please? Prevention is better than cure. And I'm very happy to say this, 80% of the strokes are preventable. People don't realize that. People just think stroke cannot be prevented. It's done. It's God's curse on you, whatever. But I'm glad to say 80% of these strokes are preventable. We can prevent it. Can I, next slide, please? And I go back to the slide with the tree I had in the beginning. This is a different format now. These 5 diseases are the main killer as far as the non-communicable disease. Heart, lung, stroke, cancer, diabetes. And you can add metabolic syndrome and more to it as well. The thing which you can do as a self-help to help yourself, you can improve your diet, cut down the fat, cut down the cholesterol, make sure you have plenty of protein. Don't smoke. There is no excuse for that really. There is nothing to say कि साहब मैंने 20 से कम करके 3 कर दी is better, but it's not better than non-smoking. Air pollution, you may have some control on that, you may not have. A lot of other factors control the air pollution. Physical inactivity, get up and going. It may not be possible in the present day with raining all the time, but you should be trying to go out 3 times a week at least for 30 minutes walk every time you go. More the better. Alcohol, stop it if you can. There are guidelines from the Western world. I don't know whether they are applicable in Indian scenario or not. But if you are drinking, for the man, if you are drinking more than 2, well, I'll forget about the guidelines. So I think you need to be very, very careful about the alcohol. Can I, next slide, please? Now, once you have that, you have some other factors for which you need the help of a doctor. You may have a high bad cholesterol or low good cholesterol for which you need a support of a doctor. You may have blood pressure, smoking I talked about. You may have diabetes, you have irregular heartbeat, you may be overweight, obese. All these factors are important risk factors which can be managed and controlled. Can I, next slide, please? The next question is, there are some factors which is not within our control. For example, age is not in our control. We are getting old every day. If you are 75, if you're lucky enough to reach 75th birthday, chances are 20% of the women and 17% of men will have had a stroke by that time. Sadly, compared to Westerners, Indians get a stroke at early age. Heart attack occurs at early age in India as well compared to the West. If you have a positive family history of heart attack or stroke, I'm sorry to say that chances of strokes are high. If we are Indian or if we are Afro-Caribbean, we have a higher risk of having a stroke compared to Caucasian. Can I, next slide, please? There are other factors which are not in our control. If we had a previous stroke, the 1 in 4 chances are we will have another stroke. 25% people who had a stroke, they will have another stroke. And for that reason, it is very, very important to look at the risk factors and do something about it to cut down the risk of having a second stroke. If a person having transient ischemic attack, I'll stop there for a minute. Transient ischemic attack is something, डॉक्टर साहब मैं बिल्कुल ठीक था, बैठा हुआ था, मेरी जबान लड़खड़ा गई, आधे घंटे के लिए हुई, या मेरे हस्बैंड के वाइफ को ऐसा हुआ जी, घंटे भर में या 2 घंटे में बिल्कुल ठीक हो गई. मिनी स्ट्रोक था जी, भगवान की दया सब ठीक हो गया, अब तो मुझे किसी किस्म का बड़ी या चिंता नहीं है. Well, I beg to differ. That's the case you need to worry about. Because the chances of having a stroke after this event is about 10 times more compared to if you have a full-blown stroke. So don't take it lightly, please. If you had a mini stroke, so-called mini stroke, which recovered within 24 hours by definition, then you must seek the medical help, get your risk analysis done, and have all your risk addressed, please. If a patient had a heart attack, they are twice at risk of having another stroke as well. Sadly, there is a gender difference as well apart from the race. Women are more likely to have a stroke than men. And I know this is the ladies group. Can I, next slide, please?
Before you answer a few more or explain us a few more things, over here I would like to ask you that you've just spoken about women having a higher stroke margin. Can you explain that in depth, Dr. Bansal?
Surely, surely. I'm happy to do that. I hope my next 4 or 5 slides, which I run through, will be able to take you through that. These are some of the US data. I know few names which are looking in from the US. Maybe you want to have a look at the guys so sitting in the US and watching this webinar. In US, 1 in 5 women will have a lifetime risk of having a stroke. 20% of the women will have a stroke. We worry about the breast cancer. People die of breast cancer, they certainly do. Stroke kills twice as many women as the breast cancer. Surprised? That's a fact. 60% of the people who had a stroke, they will die within 1 year. Remember, I said 1 year mortality or death rate was 40%, 41% I said earlier. You look at this specifically in the women group, you're talking about 16% mortality. I'm sorry to say this, more chances of having a stroke, big killer, and chances there is a problem. But good news is 4 out of 5 strokes are preventable. I'm just going back to the prevention again. And our next slide, please. Looking at the risk in the women specific to which are particular in the women, what does put the women at the risk of this stroke? High blood pressure. 33%, 1 in 3 women have a high blood pressure, which is greater than 140 over 90. The problem is, first of all, because all these things are silent, you don't know anything about it. But if you do, even if you do that and you go and get some medication, half of these blood pressures are not controlled properly. They still remain high. You get a medication, you come away happily, I'm taking the blood pressure drugs and my blood pressure is okay. I'm sorry to say that. That may not be the case. Blood pressure needs to be removed, kept to be under control, otherwise you will stay at a higher risk. Age, I already talked about. Women live longer than the men, we know that. And if you look at the Uttarakhand, average age in Uttarakhand for a lady is 71. For the man, it's 65 right now. There's a difference of 6 years. There are other factors as well which are specific to women. Pregnancy, during pregnancy, blood pressure can go high. And sadly, the ladies are more prone to have anxiety and depression, which is a risk factor for the stroke and risk factor in the improvement as well. Can our next slide, please? These are the Canadian data. They did the survey in Canada and they found all the women they screened had at least one risk factor, which were there and they were not aware of it, which is important. Well, prior to menopause, of course, estrogen is there, natural estrogen is there, which can protect, which is good news. But the sad thing is, if you have the other risk factor like diabetes, that will cancel the benefit of the estrogen. Young ladies who are on contraceptive tablets as well, they are generally safe, modern contraceptive tablets, but they are safe as long as there are no other risk factors. If you are a smoker, who have a high blood pressure, who have a high cholesterol, who have other risk for the heart disease, stroke, sadly, the benefit of the stroke gets cancelled out. Benefit of estrogen gets cancelled out. And our next slide, please. During the pregnancy, we know the people, ladies can get a stroke during the pregnancy. They can have, there is a high risk during the childbirth on first few months after the birth. Why does that happen? Because sadly, some ladies do develop certain conditions like preeclampsia, which is hypertension, high blood pressure, and kidney disease, which can happen, which need to be monitored and treated properly. And they can develop diabetes during the pregnancy as well, which can be totally asymptomatic. And it is for us to check your blood sugar and do something about it. And our next slide, please. As far as the menopause is concerned, after menopause, the benefit of the estrogen are gone. That increases the risk of this stroke. And why is that? Because it affects the cholesterol. We know lack of estrogen increases the bad cholesterol and decreases the good cholesterol. That's the bad news. Sadly, with the age, blood pressure goes up as well. Sadly, with the age, obviously body mass And I'm not talking of general obesity, general increase in the body mass. I'm talking about the central body fat. I'm talking about truncal obesity. I'm talking about the obesity around abdomen. And that is more dangerous. And if you want to give it more specific tongue, we're talking about hip to waist ratio. So higher central obesity carries a worse prognosis compared to general obesity. And these are the people we call the part of metabolic syndrome who are prone to develop diabetes and the blood sugar problem as well. And if somebody taking HRT, then that also puts them on the increased risk of the stroke and heart attack as well. And our next slide, please. So I hope I tried to explain the special risk factors which are there amongst the ladies, which puts them at the extra risk compared to the men. I discussed the risk factors which are there before stroke happens. But sadly, if somebody has a stroke, then their risk factor needs to be assessed as well, what we call the secondary stroke, secondary risk factors after. So the risk factors which are after the stroke, secondary to stroke. Same thing, blood pressure, cholesterol, blood sugar, get active, eat better, lose weight, don't smoke. But see your doctor as well, because they might like to prescribe you certain medication which can help you in prevention of the stroke as well. And our next slide, please. This is the take-home message from this presentation today. Stroke is a leading cause for death and disability. I hope you agree with that. It's a preventable disease, which is a good news. You should know your risk, only then you can prevent it and do something about it. If somebody developing the stroke, know the early signs of a stroke, get them to the appropriate center for the treatment, and remember the golden hours which I talked about, 3 to 4.5 hours, 6 hours. And it is important to take them to early rehabilitation or to a properly equipped center. And during the whole process, family.
हमारा कैमरा नहीं आ रहा, हम ये कह रहे हैं.
Okay, that's it really. I need to say.
इसमें हमारे फोटो नहीं दिख रहे. क्यों? हाँ.
Bansal.
हाँ.
Yeah, Dr. Bansal. Dr. Bansal, can you hear me?
Yeah, I can.
All right. You just mentioned about a properly equipped center and coordinated services. Can you just tell me, can you elaborate more on this? And also, can you just tell me if there is any such center which is available to us here in Dehradun?
Yeah, well, this is what I have been doing over the last year and a half or two as well, Archana. I told you type of the services which are required for a successful management of the stroke. I told you what is all required, and obviously under this situation, the family is running around to find a proper qualified person to deliver this type of service. And I have experience of running this type of service in England for 20, 30 years, and I always felt the need of this type of service in Dehradun. That is what led to this development of ANRC, Advanced Neuro Rehabilitation Center. I do apologize to you in advance and to all the audience if it looks like an advertisement for ANRC, but there is no other way I can explain what we do here. I wish I could, but there isn't. But what we do at ANRC, we try to help the patient to achieve the highest level of function and independence possible to these people. We try to improve the quality of life, physically, emotionally, and socially, in all aspects. And our next slide, please. We provide these strokes, not only the rehabilitation for the stroke, but for spinal cord injury, cerebral palsy, brain injury, Parkinson's disease, other neurological disorders. These are the neurological things, but we are well equipped to provide the other musculoskeletal disorders as well. Muscle injuries, bone injuries, or whatever else. And our next slide, please. This is some of the facilities we have. This is our rehab area, which you saw. This is our area where we have a gym and all that. This is the special area for pediatric therapy for people, children with the cerebral palsy. On that separate room for them and the separate facility for them. This is the main entrance for this our facility, and this is the specialized computerized lab we have for helping the recovery of this patient with the stroke. And our next slide, please. In this lab, computerized lab, we have got these 3-4 computerized machines. This machine works on the basis of biofeedback. So with the EMG electromyogram, we assess the initial strength of the muscle, and we set the target for the person through the machine, and then the person is encouraged to reach those targets as well. And those improvement in the function happen before you have a visual improvement in the function of the arm or the leg or whatever else. So this gives you a visual feedback to the person that I am improving, which encourages them to get to further. The middle machine, which you have here, this is for coordination of the upper limbs. In hemiplegia, one side is paralyzed. It loses all the coordination. Using the help of the other arm and this machine, we try and improve the coordination of the both arms by moving them together. This machine is for the balance problem. People are falling about who can't maintain their balance. So these are 3 machines we have for that. In addition, we have this is called tilt table. This is to investigate the people who've been falling about, who have a vestibular problem with the inner ear and all that, who needs the further assessment and all that to prevent the falls from this disorder. And our next slide, please. So what we have, we are aware that people can't be coming to the center all the time. They can't be coming, and they might require the more input than just an hour or two. They might require 2-3 hours in the morning, 2-3 hours in the afternoon, and they can't be coming and going. For them, we have the inpatient facility. They can stay. We have the rooms there, and for them, we insist that they should be carer with the patient. And it is important we have to have that because we want to optimize the recovery and we want to educate the patient and carer and prepare them to return home and manage at that home. So this gives the confidence to the carer. I can manage the problems at home. He or she is saying himself, I need help getting this person out to the toilet. I need help to get undressed and all that, or whatever else, with the tablets, feeding, whatever. And under the controlled situation, we can educate them and train them, and they can go happily after that. And our next slide, please. Once they go home, if required, we still have a home care plan as well. So we have an outreach team. They can go there to visit them. We also know few people may not be able to come to us in the first place. We like to see them once, and if necessary, we can discuss the plan, home care plan, and share the plan between the home care and our clinic plans as well. And our next slide, please. And our next slide, please. Apart from that, I talked about the prevention and health education. I mentioned silent killers. I mentioned to you, this is the only chance we may have to stop the catastrophe from happening. And for this, you need a regular health checkup and know your risk. We can help you with that as well. Thank you. Can our next slide, please? That's all I have to say. Archana, if you want to have any question, I'll be more than happy to answer.
Thank you so much for all. Thank you for the insight into this health issue, Dr. Bansal. Over here, before I open the platform for question answer session, there is a small little personal question I would like to ask you. You've been awarded and rewarded with a whole lot of prestigious awards like Hospital Doctor of the Year. You have a seminar room to your name, and you also have been invited to the Buckingham Palace by the Queen, not only for the felicitation ceremony, I know, but also to treat her at one point of time. My question to you is, you could have led a very good retired life over there. A year in India. India welcomes you, but why so?
So, it's a very personal question. Well, Kiranji gave you in my synopsis in the beginning what have I done, where I started. So India was my Janmabhoomi. I was born here. I have my foundation here. I got my early medical education here. But my Karm Bhumi has been England. That's where I worked all my life. 35 years of life I worked in England. I did practice there, learn a lot of skills there. But there comes a time in the life then you want to give something back to your country, to your roots, where you come from. And that's what I've been trying to do for last 15 years or so. That's the reason I came to Jolly Grant, to Himalayan Institute in 2009. When I changed my personal contract in England from a full-time consultant to half-time consultant, dare I say, at cost of losing lots and lots of money as well. But that's a different story. I came here, worked 6 months in India and 6 months over there, which I carried on doing for last 9 years, 2009 to 2017, 8 years I did that. The point was this, all along I felt there is a need of neuro rehabilitation service because this service was non-existent, and as I said to you, I was running this type of service in England. And there always come a point in the life, I still remember, and a colleague of mine in England in medical college, and then very senior man, very senior faculty person, well respected, number one head of the department. He had a stroke, sadly. His wife was very well placed lady doctor as well in the institution. And I went to visit him. He was lying in a huge room and obviously very despondent, very sad. And when he saw me, some tears came out of his eyes as well. Next time I went to see him after a week or so, I found he's gone to Delhi for treatment. And then he came back after a month from there, and I found after 2 months him sitting in the front row in one of the seminars at the hospital. And I felt, well, hang on a minute. Why do the people have to go to places like Delhi and beyond? Why can't we provide this type of services? Particularly when I have expertise of that. And that's what it is, Arjun. I'm just trying to pay back.
Thank you so much, Dr. Bansal. And because we're running short of time, so I'll just open the room for question answer. IT person, please, will you help us with connecting Mr. Behel, who has the first question for us? Mr. Behel, please. Can I?
Maybe we can take Anuradha Dobalan meanwhile.
Am I audible?
Yes, you are, ma'am.
Sir, many thanks, and we are honored that you are in this. I have attended this webinar and very informative webinar. So my question is that you have said that India has more strokes rate than other countries. Why is it so? And if the medical facility is far, then what is the first aid that we can give to the patient before reaching the hospital? If any.
Well, two questions here. First question was, why do I think there are more strokes in India compared to the rest of the world? And this comes down to the root risk factors. We do know, you heard it many times, you read in the news items here and there as well, that India is supposed to be capital of diabetes. You know that. That's what we've been talking about. And if I ever get a chance to speak about diabetes, I can tell you diabetes is the mother of all non-communicable disease. It's the mother of everything. Because diabetes, we think, is the blood sugar. That's only what we see in the biochemical lab. Sadly, this diabetes affects every part of your body, primarily your blood vessels, which is what causes the damage to your problem with the heart, and problem with your lung, and the problem with your brain. That's number one. As far as what should we do in the first part of this stroke, that's a difficult question to answer, but There is a thing called ABC, airways, breathing, and circulation. That's the cardinal thing for anybody, and that is a training itself, which I think IMA Dehradun has been trying to do for the people, which needs to be done to the civilians as well, which is done as a routine in many Western countries, in USA and UK and European countries as well, where people are treated. A lot of you have traveled all over the world. You will see the defibrillator put at various airports as well. That is a part of all initial survival resuscitation. Airways, breathing, circulation, ABC. Specialist area, madam, I could talk for half an hour on that.
Thank you, sir. We will have another session for that, sir. Thank you.
Radhaji. The next question is from Dr. Geeta Khanna. IT, please, can you connect us to Dr. Geeta Sharma? I said Dr. Geeta Khanna, please. I'm sorry about that.
Yeah. Hello. Hello.
Good evening, doctor. Good evening to
Yeah,
you.
good evening. Hello, can I speak?
Yeah, of course. Well, yeah, I can hear you all right, Dr. Khanna.
Yeah, good evening,
Hi.
sir. Just for
evening
the
to you.
benefits of everyone, I think we must tell them something about there's a lot, that floods, and because stroke is something that would not have a complete recovery most of the times. So, everyone keeps flocking for all kinds of supplements these days. And the post-stroke care also, what are the do's and do nots as far as diet and nutrition and supplements. So, most of the time supplements becomes a substitution for the nutrition. So I think if we highlight a little on these aspects for a general population, because most of our key members are not medicos.
I did touch on one slide on that after stroke, madam, secondary prevention.
Yeah.
People who had a stroke, the risk factors are same as primary prevention. So you have to have a sensible diet. You have
So that's what a little about the diet and supplements, sir. A little elaboration.
If you're asking me to tell you supplement, there is no supplement, man.
This is what I want you to emphasize, because then because it is sort of a, whenever there is, so all kinds of people go for the net and then give ye wala omega dene se ye ho jayega, and this kind of amino acid will
omega 3.
Just wanted you to highlight on that there are no such supplements which are specific and all that stuff.
There is some evidence that fish oil, that's what is omega 3 is.
Yeah. Yes, sir.
Is helpful in the brain and heart health. There is some evidence of that. There is some evidence that ginkgo, which is a Chinese South Korean herb, which is available in tablets as well, that is helpful as well. But beyond that, if you ask me, does it make a difference to the outcome of the stroke? I'm sorry, there isn't any evidence of that.
Yeah, that's what. Because through the net and all the advertisements that these supplement manufacturers make, I feel there's a lot of confusion, and people confuse nutrition and diet with the supplements. So I think good nutrition, good diet.
WhatsApp is a very good teacher. I learned a lot from WhatsApp as well.
Right, there is yet another question from someone over here who wants to know, if the medical facility is away, what first aid we can give to the patient before we reach the hospital? I think that's a pertinent question.
I already said that, Archana, ABC, airways, breathing, circulation. You cannot do anything about circulation at home. Certainly you can try and do the airways. You must put patient on the floor or the hard bed on side, because one of the problems happen in these people, tongue can fall back while they are lying on their back, you see, and that people can choke because of that, you see. So you must lift the chin, putting by the hand under the angle of the mandible and lifting it up so that the tongue goes forward, airways open up. That's important thing to do. If they are artificial teeth, take them out, please, because that can be a problem as well. They can have a vomiting as well while this is happening. Put them on the side. The vomiters out. It does not go back into the lung, you see. Beyond that, I'm afraid there isn't a lot you can do at home apart from keeping them comfortable and get a help. One thing I think you must remember, what people do that, and I took a lot of time to come to terms with that. That people fall down with a stroke, and the first reaction is lift up the patient, put on the bed. That's the first reaction generally people have. Comfortable bed पे होंगे बिस्तर में लिटाओ जी. That probably is not such a good idea. Lying on the floor is probably one of the safest place for the person, so long you can turn the patient on the side so that if there is a vomiting, it goes out on the floor and the tongue does not fall back. Do not be in a hurry to lift the patient and put them back to the bed. Don't be in a hurry on that. Make them comfortable, of course. Whatever you wish to do, put a pillow, cover with the rug or whatever you do. But don't be in a hurry to lift them and put them in the bed. That's not a good thing to do. That's not a good idea.
Thank you so much. I think this was great information. And I now pass it on to Gauri. Back to you, Gauri.
Thank you, Dr. Bansal. It was very, very beautiful session. I would now like to invite our Senior Vice Chairperson, Ms. Komal Batra, to say her vote of thanks.
Thank you so much, Gauri.
Komal, over to you.
Dr. Bansal, this was an eye-opening webinar for most of us.
Thank you, ma'am.
We did know that brain stroke was an important issue with us since the cases are increasing more and more. But the way you've elaborated on the whole personality, I would say, of a brain stroke was very detailed, and it helped us understand what we can do, what we can consider, take care of, so that we are well aware in time to prevent it rather than go for a cure later. Thank you so much. And we are so glad that we have ANRC right here in Dehradun and that are available to us. Thank you so much for exclusively being present here.
Thank you, ma'am. Thanks very much. Thank you for inviting me. Thank you for me having here to speak on this subject.
The pleasure is totally ours, sir. May I request the IT team to please showcase our vote of thanks, our token of appreciation for Sir through the memento on the screen at this moment.
Oh, my God. Thank you. Thank you very much. Very kind of you. Thank you.
You're most welcome, sir.
Thank you.
I would extend our heartfelt gratitude to Ms. Archana Mangalik, who conceptualized and had on board Dr. S.K. Bansal, bringing this valuable information and this valuable person on the flow chapter and helping us understand such minute and such important details about our own body's most important organ. Thank you so much, Archana.
Archana,
Thank you so much.
Thank you for organizing. I personally extend my gratitude to you as well. Thank you.
Thank you so much, everyone. Thank you so much, the FICCI platform, the Flow platform, for having us. Thank you. And it was a wonderful audience that we had. Thank you so much.
Gratitude to the entire team that goes behind our secretaries and treasurers. My warmest gratitude to all the viewers who logged in from different cities and in fact different countries. Like Sir said, there are some friends of his from the US as well. Thank you so very much to everyone for logging in and supporting us. I would request now Tripti to come on and share with us what are the future programs that we have on board for our members.
Thank you, Komal. Upcoming.
Our next program is on responsible cinema. Sorry.
Thank you, Komal. Our upcoming webinar is 21st July, Tuesday. That's on responsible cinema with National Award winner, cinematographer Mr. Amitabh Singh, who holds titles like Hosla Ka Ghosla, Chilla Party, and many more. Looking forward to see you all on 21st July. Thank you.